Hi, acupuncture gynecology patients, endo warriors, and acupuncture friends. I just wanted to, for the last day of Endometriosis Awareness Month, do a live video. So again, I did this the other day and I'm looking back and forth because I only wanted to do this once. So I am doing this from my Facebook and Instagram page simultaneously. I wanted to share the story about what happened to me in 2017 with my last endometriosis surgery and what made me decide to focus on endometriosis in my gynecology practice, my acupuncture gynecology practice. So I, for years, struggled with managing my endometriosis, and in 2017 I was doing continuous birth control pills, which is meant to have you not get having my an ultrasound done. So I had just bought the building that I'm in now, and things were not going well. I had these attorneys in here who wouldn't leave, and they were just being real jackasses, to be honest. My attorney was trying to get them out, and I was standing in the treatment room one day, and I got this horrible cramp, and I knew what was going to happen. And I started hemorrhaging. And of course, since I hadn't had a period in 3 years because of the birth control pills, I knew something was very wrong. Also had nothing, which is a lesson learned that I should always have products in my office just for patients even. So that was on a Thursday. I called my doctor's office the next day and said, I'm hemorrhaging. And they said, okay, come in and we'll tell you if you're anemic. And I knew that in 24 hours I wasn't going to be anemic. So of course they drew blood. My hemoglobin was a 13, which is normal. They did an ultrasound and they could physically actually see on the ultrasound the blood shedding off of the lining. So they sent me home and told me to add progesterone. I add progesterone over the weekend, a single dose each day. And on Monday I'm still hemorrhaging, and I'm counting the number of feminine hygiene products that I'm using. And I call on Monday and I'm like, well, how long is this supposed to take for the bleeding to stop? So they're like, it hasn't slowed down. And I'm like, no. And they're like, well, you could come in and we'll draw blood again and tell you if you're anemic. And I'm like, I'm not going to come in and draw blood again. Tell me how to stop it. So they're like, okay, add a second dose. By Wednesday, it's still not slowing down. I then call again. And they just keep insisting that I can come in and that they'll draw blood. So I'm taking herbs to try and stop the bleeding. I'm taking the birth control pills. I'm taking the progesterone, and it's really not, the bleeding just is not slowing down. So now I'm supposed to drive my boyfriend's kids back to Tennessee. And this went on for like 2 weeks of the hemorrhaging and me going back and forth to the doctor. And I don't know whether, as women, we are dismissed with what's going on and treated as though we must be exaggerating. I'll post it underneath this when I'm done, how many feminine products I went through. So finally, after 2 weeks of them not really telling me that they'll do anything other than draw blood to tell me if I'm anemic, I'm like, fine. I'll drive over to the doctor's office. I drive over and I walk in and I am ghost white. And they're like, who drove you here? And I'm like, I drove myself. They rush me in an ambulance to Robert Wood Johnson New Brunswick Hospital. They draw blood and my hemoglobin is a 3. When I tell you that I could hear my heart beating in my ears, I was short of breath. I just couldn't function anymore. My GP, who got the results of all that, the blood work and all the hospital reports afterwards, told me he's only had one other patient that was that low in terms of hemoglobin. So they know that they now need to do this emergency hysterectomy, but they can't do it because I'm close to being dead, almost no blood left in me, so they have to start transfusing blood. They transfuse 6 bags of blood, which is why earlier I did the post about that. I'm trying to donate blood to give back because there's a lot of people who saved my life. So I had 6 bags of plasma and 2 bags of platelets to stabilize me. So they don't transfuse everything you've lost. So when I left the hospital, my hemoglobin was a 7 after all of this. So that's about the halfway point of where it should be. So they transfuse this blood, and now all of a sudden I realize when I'm walking back and forth to the bathroom that I'm limping and my leg really hurts. And I reach down, and acupuncturists will know this, there's a point that's like 3 fingers above the inner part of the ankle, spleen 6. And I can feel a blood clot in my leg. So from hemorrhaging, my body was overproducing clotting factor to try and stop it, and it made this blood clot. So now it's, and they're like, no, and I'm like, no, you really need to check my leg before you do any kind of surgery because there's a blood clot in my leg. So they do an ultrasound, and of course I'm right, there's a blood clot in my leg, and now they have to monitor that for a little bit, like before they can put me under the knife to make sure that I'm not gonna throw this clot and then have, a stroke. So they do the hysterectomy, and they're like, yeah, you'll pretty much be able to leave. They did have to transfuse more blood products. So I'm figuring at least, 10 or more people saved my life with blood transfusions and platelet transfusions. So they catheterize you during a surgery, and I hate being catheterized. I've hated it during every surgery. I'm like, get that effing thing out. They take it out, and I can't go to the bathroom. So now they're pushing fluid, and I'm not going to the bathroom. So now they are like, something's really wrong because this has gone on all day. So now they inject dye up into the bladder, and my whole entire abdominal cavity lights up because the doctor tore my bladder, which I had asked for them to do the hysterectomy through my C-section incisions and my prior endometriosis surgical incisions, because I felt like I was too complex a case, and they were insistent that they could do a vaginal hysterectomy. So now I have a torn bladder, and they can't go back in the way that they took the uterus out. They now have to make another incision, and I'm now begging this urologist to please just go through the existing incisions that I have, because the more incisions you have as someone who has endometriosis, the more scar tissue it creates. So he's like, no. So now they cut me from belly button down through the other incision, and it's my bladder and my right ureter that is shredded. So now I have to have a stent put in, they have to repair the bladder, I now have to have a catheter in for, well, initially they thought for longer. The stent stays in your ureter for a month. The catheter was only in for like a week. And now I come out of that, and now from being under anesthesia twice, my intestines aren't working. So they're like, have some food, we'll try and get your bowels moving. It's normal for them to kind of be a little sluggish, but now they're not moving at all. So now I have to have a nasogastric tube put in to take out everything that's sitting in my stomach and not being digested and moving into the small intestine because my intestines aren't working. So this whole ordeal took about 2 weeks. It took me probably a good 6 months till I felt a little tiny bit better, and it's 3.5 years later now, and I still don't feel like I'm quite the same person as before. If I drink the correct amount of fluid, because now my bladder has been reconstructed, I feel like I'm going to the bathroom all the time. And I do realize that in terms of what goes on for some people with endometriosis, it could have been a lot worse. I could have needed an ostomy bag for either, bowel functioning or urine functioning, but I'm not the same person that I was before. I feel like, and when they tell you that a hysterectomy cures endometriosis, it absolutely does not cure endometriosis. I still have endobelly, I still have all the food sensitivities, I still have gastrointestinal issues, all of that still goes on. So I wanted my followers to hear my story firsthand about what happened. And someone had said that when you can tell the story and not cry, you've healed. I don't know, I can tell it without crying and I can laugh about it. There's so many components to it that at times I feel like, I can't believe all that happened to me. I lost half the hair on my head afterwards because abdominal surgeries make you prone to losing your hair, as well as being under anesthesia can make you lose your hair. So yeah, it has taken me a long time to come back, and it's one of the reasons why I wanted to focus my practice on helping other people who have endometriosis. I feel like it's a calling for me. I don't want anyone who has endometriosis to have to walk this path alone. I know personally firsthand that without acupuncture and herbs, I wouldn't even be where I am in terms of the surgical recovery. I feel like I would have been a lot worse. I came back fairly quick and built blood up fairly quick because I was doing all those herbs and all that other stuff. But really, my girlfriend Erica, when I was telling her the story, and I'm sure I probably even in now telling the story of the surgery, I'm forgetting components of it, but it really was like an episode of House, the television show. And I feel like it was a lot of chasing what was going wrong. And it just impacted so much in my life. And, I will never be the same, but I don't want anyone to have to walk this path alone. So again, it's Endometriosis Awareness Month. I wanted to share the story of my most recent surgery. I have had other surgeries, which I'll probably share stories about later on. But yeah, this, for a disease that's considered one of the 20 most painful diseases, it effing sucks. It is not a fun disease to have to manage. And like I said, for the end of the month, I wanted to share that story. So thanks for listening, and I hope everyone has a great day.